Hey guys, welcome back to my channel. If this is the first time that you'll see my face, my name is Miss Renee Richards and I'm a qualified registered dental care professional. And over on this channel, we cover all things dentistry and faith and a little bit of everything else that is mixed in between. So if that sounds like your sort of thing, I would love for you to stick around and join my growing community. For most of you who don't know, I've recently successfully finished dental school, and I've been asked many times, is it something, if I had to do it again, would I do it again? Would I? Let's get into it. So a dental hygienist, which is what I've qualified as, is a dental care professional whose main goal is to manage, treat and prevent gingivitis and periodontal disease or gum disease. So their main goal is to keep your gums healthy and give you the tools and the resources that you need in order for you to do so at home. So a quick backstory for those of you who are not familiar with me. It took me 10 short years to get to this position. I had a bright idea during maternity leave back in 2015 that I wanted to get into the field of dentistry. And that led me into many applications, many interviews of getting into dental nursing apprenticeships or a trainee dental nurse position. And 99.9% of those doors shut on me. So in 2019, by the grace of God, I was given the opportunity to get onto a dental nursing position in Teesside. And in 2021, that led me into getting onto the BSc Dental Hygiene program again in Teesside. So year one of the BSc program was great. Year one pretty much looks like a mixture of lectures and being on phantom head. The lectures, I would say that we did lectures pretty much maybe 2 to 3 times for the week, possibly even 4 if I'm not mistaken. And again, that would be mixed into the phantom head sessions. Phantom head sessions I thoroughly enjoyed. For those of you who aren't aware, phantom head is pretty much that. It's a phantom head that we practice on. And those sessions we would build on our knowledge of instruments and where things would be positioned and why, and the teeth as well. The sessions really just build up our confidence and our skill sets and our knowledge that when we do go out to treat patients, we can do so safely and competently. I thoroughly enjoyed those sessions. With those sessions, I think each week we would have like a test to ensure that, you know, when it comes to scaling the teeth, we were doing them safely. When it comes down to probing, doing BPs or 6-point pocket charts, again, we were doing those things safely. And I I really enjoyed those sessions. The lectures, I would say, the workload, it was really manageable. We had a mixture of test and examinations and courseworks that we would do, and they were pretty manageable. I really enjoyed first year for what it was. For me, where the difficulty came into it was that I came to Teesside as a single parent to, at the time, a 4-year-old boy back in 2019. Now, when I did the dental nursing course, I had access to childcare because there was a nursery that was situated close by to my son's school. On days when I would need to go to placement, they would collect my son after school and I would pick him up after placement. So that was fine. However, the drama began in year one when the nursery closed down, and I struggled is an understatement, for childcare. Bearing in mind, I've come to Teesside as a lone parent. I've got no family. I've got no friends. I have a zero support system. I had no one. It was literally just me, myself, my son, God, Jesus, and the Holy Spirit. I had no one here. So I heavily relied on support that I could get from people from my church. There was one person in particular that sometimes when she could pick my son up from school and I would collect my son from her on the days that she could have him, that she was able to have him. For me as well, I also had to pay for tuition for my first year. And I had to, in order for me to do that, I had to work at any given time 2 to 3 jobs. Yeah, at any given time, just to ensure that not only that I could pay my tuition, but I could also pay my bills. And that in itself, that was really challenging, because remember, I'm not only now committed to having a commitment to not just one job, but 2 and 3. But I also had my commitment to my full-time university position, and I had my commitment to my son as well as to myself. So that in itself was really difficult. But I, at the time, didn't see that I had a choice, because I had my tuition to pay. And there was no way that I was going to give up my place on that course that I've really fought and cried a lot of tears to get on. So I decided to bite the bullet and do what I had to do. And by the grace of God, I was able to do what I had to do. Now, another issue that I faced with year 1 is that at the beginning of the course, everyone had to submit a DBS, which is pretty much your police record. Sometimes they can take a little time to come back in, and sometimes they can also take a very long time to come back. I was one of those people where my DBS took forever. My DBS took forever and a day to come back. You would think that I was in some cartel and I was in some big gang or something, because what? My DBS took months to come back. When my DBS eventually came back, it was like the final week before the summer break. So how year 1 was set up is that not only would you have lectures and the phantom head, but after a certain point, the year 1 students were able to go onto the student dental facility and I guess get a feel of how things would be of a day-to-day clinic, a typical clinic day, as well as assisting the year 3 students. So that experience I had missed out on, that hands-on, experience I'd missed out on, all because my DBS took so long to come back. Here comes year 2. I'm already feeling a little bit, I guess, somewhat having imposter syndrome. I felt like a fraud because I didn't have this experience that the rest of my cohort did, because obviously their DBS came back at a normal time and they were able to go on to clinic. So I didn't have that experience that they did. And yes, I passed all my phantom head tests and I was doing good in other areas, but the hands-on experience I didn't have. So come year 2, I was already feeling a little bit jittery. I was already feeling a bit scared. I was already feeling a little bit out of place because of this experience that I did not have. But, I just threw myself in there and did the very best that I could with the help and support of my peers and the clinical supervisors. And it went well. It went well for the most part. It went well. Now, how year 2 was situated was a pretty much same setup as year 1, where we would have lectures maybe 2 to 3 times for the week. And then I think we were on the student dental facility between 2 to 3 times for the week. So we were pretty much at university 5 days a week, and it was really full on. Not only did we have the lectures, but we also was doing the preparation for the dissertation. And baby, that in itself was something. We didn't really have phantom head sessions as such. It was now more so treating patients, and I loved treating patients. As much as I said before that I had that sort of imposter syndrome, when it was time for me to really get down to it and build a rapport, build patient carer relationships with my patients, I thoroughly enjoyed it, loved it. Absolutely loved it. Year 2 felt a little bit more easier for me in the sense where I wasn't working this 2 to 3 jobs anymore. I was down to one job where I would be working, I think my shift started between 6 and 6:30, so it was after university, so I was able to really give my full focus to uni and then come home, work for, I think it was 6 till 11 or 6 till 12 was my shift, and that was good for me. It again was intense, of course, but it was a lot more manageable for me, physically as well as mentally, than year 1 when I'm working 2 to 3 jobs, because what the hell. In terms of childcare for year 2, I struggled. I really struggled in year 2 when it came down to childcare, and the reason being was that the person who often could pick my son up from school, who I met through church, she was at that point hit or miss. There was days when it was fine, she could get him, and there was days where she had other commitments where she could not. And for those days, I struggled. So for me, on the days where I did not have childcare, I would either have to leave clinic or leave university early, or sometimes not even attend. And that was really frustrating because there was sort of nothing that I could do. And boy, it was really rough. It was really hard, but you know, I did the best that I could given what I had to work with, and I was just like, Lord, you got to do something here, because what can I do? I can't leave my son at home. I can't leave him by himself, and I also have to be. It was really difficult. It was really hard. So final year rolls in. Final year rolls in. Final year. Final year was something. Year 3 comes along, and this is where everything now, you know, I mean, it was always serious, but it's that final year, you know, you're now one step closer to getting this qualification. You're one step from really being that clinician that you've been training and you've been practicing to be. In terms of childcare, things now start to get a little bit easier for me because my husband now has entered into the UK, and so on the days when he's not working, he's able to pick my son up from school. So in terms of childcare, I had no issues with childcare. I had no days that I legit missed because of childcare. Praise be to God. That was fabulous. Workload and how they structured third year, we had a lot more free days because we were probably at uni maybe once or twice for the week where lectures was concerned. And then for student dental facility, we were there maybe, I think in semester 1 we were only there once a week, and then that increased over the other 2 semesters, so maybe about two or three times, 2 times for the week. We were on the student dental facility. Whatever hardships that I was either facing with examinations, which I did face trials and tribulations with my examinations, but whatever hardship that I was facing with either examinations or anything else in my, you know, private personal life, being on the student dental facility and actually treating patients is like everything else was forgotten and everything was pushed to one side. I love being in that clinical environment and, again, building patient carer relationships with my patients, and seeing patients who I've treated from the very first day finishing their treatment session, and seeing the progress that they've made, the advice that I've given them that they've taken on board. And you can really see the confidence being brought back into their smile. And that's really heartwarming. That was really heartwarming for me. So I really had a sense of joy when I came onto clinic. I enjoyed being there. I enjoyed the knowledge that I was able to get from my clinical supervisors, and the knowledge that I'm able to pour back out into my patients, and that gave me a real sense of joy. So Third year for me was bittersweet. It was bittersweet for me because, again, as I'd mentioned to you before, the issues that I had with my DBS and childcare from year 1 and year 2, it did have a domino effect. So because of time that I'd missed out, I wasn't able to go onto the external placements that my other peers, or many of my other peers, because not everyone did, but many of my other peers did go out an external placement. I was like, man, that sucked that I wasn't able to do. It's something else now that I'm missing out on that my other peers were able to do, but I'm not able to do. So that really sucked. That felt like a punch in the stomach. However, I looked at it in a way where I could still able to spend time with my clinical supervisors and pick their brain a little bit more and, you know, get their years of experience and knowledge, you know, poured out into myself. So yeah, I looked at it that way, and I just utilized, you know, them as to the best of my ability, and asked them so many questions and asked them if they could sit with me during this this treatment, just to see if there's anything else that I could do differently. As I said, I was building good patient care relationships with many of my patients. I had a patient who had a fear of being in the dentist. They had a real fear of the dentist, to the point when they came in, they've never seen me before, and they started to cry. It was like, I'm so sorry, it's not you, it's me. And they started to cry, and that broke my heart. And I was like, you know, I spoke to them, I reassured them that, listen, I'm here to help you. I'm not here to hurt you in any way, and we'll take this, we'll do today's session on your pace. What you can manage, what you can deal with, will go on your pace. There's no rush. And I managed to make some progress with their treatment. And at the end of the session, they gave me a hug and they held my hand and they said, thank you so much. And my clinical supervisor at the time, they noticed that I think they had never worked with me, that particular supervisor, they never worked with me. And she was in the background and didn't realize she was observing me. She was observing everything. She came over and she was like, wow. And she gave me a merit for that treatment session. But even if she didn't give me a merit, for me, again, as I said, being able to get a patient in who is absolutely scared of being at the dentist, to feeling so comfortable to allow you into their mouth to start treatment, it's no-brainer. It's an absolute blessing. And those are things that I don't take, you know, I don't take lightly, and I didn't take for granted. I had another patient who got so comfortable. Again, they also had a fear of being at the dentist, but they got so comfortable with seeing me that they had ended up booking that patient in to see another student. And they came in and they was like, where's Renee? And they was like, oh no, Renee's not in today. They was like, yeah, no, I'm so sorry, I am not seeing you, I only want to see Renee. And again, those are things that I do not take for granted. So third year for me really cemented that, you know what, this is my calling, this is really where I'm supposed to be. Despite whatever challenges and hardships that I have faced or that I'm currently facing, I know this is where the Lord wants me to be. This is my calling, this is my thing to do on this earth, or one of the things I'm called to do on this earth. And I thoroughly enjoyed third year. Where treating patients are concerned, I thoroughly enjoyed third year. The work itself for third year was not as intense, especially not as intense as second year. I think second year were really tough. Even though the level of work that we do in third year is a lot more, is higher than second year, but for some reason second year's work was really diabolical. It was hard because now for third year you know what you're doing, you understand the principles, you understand the standards, understand things on a histological level and why things happen on a histological level, because you would have had that knowledge from first year and second year. So now putting that information in to the work that they were giving us was a little bit more easier, I would say. I had one piece of work that took me a few tries to get it right, and I don't think it wasn't because I didn't know the information, it was how we had to present that information. And we had a face-to-face examination, and for the life of me, I resat that exam 4 times. 4 times. And again, as I said, it's not because I didn't know the information, because I know what I'm doing, and I know the reasons why I'm doing what I'm doing. But it was a face-to-face examination, and that took me out. But that's testimonies for another video. So that leads me to, would I redo dental hygiene again? If I had to do it, would I do it again? Do this course again if I was in a position where I was doing it down south, where I had the support of my family and friends, and I was in an area that I had my own true support system. So if for whatever reason that I have placement or university finishes at 5:30, I have someone who can collect my son from school with no issues. If I was to do it again in a place where I had no support system, no, would not do it, because I know the trials and the tribulations that comes with this course, and doing this course where you are surrounded by one you know. I would also redo the course in an area that I could see people who look like me, where maybe the clinicians, the supervising clinicians, and even those who are in the course looks like me. And I'll leave that one there. Now, this course is often given with a dual qualification, so dental hygiene and dental therapy. When I initially applied for the course, it was actually dental hygiene and dental therapy, and then for some strange reason they dropped the therapy, offered that as a postgraduate qualification, and it only became dental hygiene. Now, with dental therapy, it gives you a broader scope of practice. So you're able to do stuff such as extractions on primary dentition and restoration, both primary and permanent dentition, or adult teeth and children baby teeth. I would do the course again if I was able to do it as a dual qualification, because now I'll have to find an institution who does the dental therapy as either as a degree program or a postgraduate degree program, that additional qualification. So yes, I would do the course again, but I would do the course again with a few tweaks. Dental hygiene is a wonderful profession. The knowledge that you gain, and the knowledge that you're able to give back, and the lives that you're able to impact, you can't put a price on it. So if you are thinking to do dental hygiene, don't second guess it. Don't give it a second thought. Just go for it. It'll probably be one of the best things that you can do for yourself. If you've made it this far in this video, thank you again for watching. Please remember to press like, comment and share. And I hopefully will see you in my next video. Take care, guys. Bye.